Hi, I'm Mike Duggan. I've been teaching restorative dentistry for over 32 years now and to over 6,000 dentists. This video shows how I do it. Real-time, mannequin-based, hands-on, point of view, and patient real. If you are a pre-dental student, an aspiring teacher, an international dentist, join me at Duggan Oral Design, dugganoraldesign.com. Okay. Oops, let me use mine here. So the vertical angles are critically important, okay? When those are off, then everything goes bad. So your vertical angle for the A plane should have been kind of like this.
Yeah.
And the B plane should have been like this, but look at this plane here. That angle really messed it up. So how is it going to fit the opposing tooth? And see, the direction of this ridge here should be pointing this way, right? So look at the diagram on the board.
Yeah.
Point the burr tangent to the corner of the adjacent tooth and take the vertical angle from the adjacent tooth. Then we're going to get it worked out. And of course you got way too much clearance, and this groove doesn't fit the opposing cusp. Okay, so all those things, when you do the A plane, take your time, get it just right, make the B plane at the right vertical angle so it doesn't destroy the A plane. The A plane would have had a groove here and a groove here, and then make it nice and rounded in between.
Okay.
And the B plane would have been like this for the distal side. Much more vertical angulation, pointing the burr in the right direction here. And over here, these ridges are not parallel, they come together in a V shape. So again, look at the diagram, look at my example before you do each step. Then you'll see which direction those ridges go, and you can get an idea as to the vertical angles. This ridge probably should have been shifted way over here. So you're just kind of, so for example, see that ridge right there? That's the dislingual ridge right there. You can see it, you can actually see it's not even close to the opposing groove. Right? It's 2 millimeters or more away from the opposing groove. So we're going to slow down a little bit. Take each step very carefully. Make sure you get everything where it should be so it's more likely to fit the opposing tooth. So position of the ridges, vertical angles, direction of the ridges, those are all things that we really need to get totally under control. So again, when you look at the picture on the board, look at my examples. And, you know, in both 2 and 3 dimensions, you have the chance to see what you should have done so that you could get the amount of clearance you need without over-reducing any place. Okay. So basically at this point, it's just way over-reduced. It would work. You could make a crown. But it's just not. We could have reduced much less and had a fine prep that would have worked just fine. In each step, when you do the A plane, make sure you get the vertical angle right, make sure you get the grooves in the right position, make sure the burr barely fits between the prep and the opposing tooth, and then make sure the vertical angles in the B plane don't ruin the A plane. That's what happened. Okay, at this point, if you want it, we're going to do the upper number 3 a little bit later. At this point, you can start doing some axial reductions for some practice.
Okay.
That'd be okay. And I'm going to take a quick look. Which full ceramic did you do?
I think this the
Which one is that?
canine,
6 or 11?
11.
11, okay.
Yeah.
So that's a full ceramic?
Yes.
Okay. So you sure got the margins all kind of chewed up, huh? That could easily be fixed, but, you know, with your ball burnisher, again, we should see a 1 millimeter chamfer everywhere. So over here, it's a lot less than that. Over here, it's too far from the gingiva. So you didn't really complete the PFM. So what we do is we complete the PFM, and then we go ahead and make the full ceramic out of it. Okay? But learn how to look along this wall, learn how to look along this wall, learn how to make sure you see where the margin is gingerly, make sure you learn how to see where the end of the burr is. And don't look this way when you're working on the lingual because you're always going to over taper. So we always look along each wall when we're doing it. That's how we make it work out. Okay, so you never quite got the lingual and the proximal chamfers done. It would have been a lot easier to convert it to a full ceramic otherwise. And again, learn to look for undercuts.
Yeah.
See how dramatic that is? That's really, really diverging incisally. Okay, try to do some axial reduction on 19. If you finish the occlusal reduction on 19, you could go ahead and start on the axial reduction if you like. We'll start on 3 once I discuss it and demonstrate it a little bit later. Okay, so let's see how you're fitting the opposing tooth. So the grooves are actually really broad. They're not very well defined, and you have well-defined ridges, but there are no well-defined ridges on the A-plane.
Yeah.
So we make really nice grooves, really well-defined grooves. Make sure they're exactly in the right place, matching the opposing cusps.
Right.
Then we make a nice smooth surface in between. You're a little bit too horizontal. Make sure it's more vertical.
Okay.
So check the angle compared to the opposing tooth. Check the groove positions compared to the opposing tooth. Then when you're really happy with that, then you can move on. So we got a little bit over reduced, but the anatomy's a little better. The clearance on the mesial buccal side right there, you can look through and you can see it's nowhere near enough clearance there. And the distal buccal, you've got a little bit more. So the mesial buccal,
Yeah.
we would put that ridge maybe here.
Right.
You're a little bit too close to the center. So put it a little closer to the mesial side and it's easier to get clearance. Come down this way, bring the end of the burr out the groove.
Yeah.
And then this ridge, we point it this way. Not this way, tangent to the corner of the adjacent tooth.
Okay.
Just like I drew on the board. That's how we're going to get the clearance without reducing too much.
Okay. That's all right.
Now we're starting to see some clearance over here. Distal lingual cusp probably needs to be shifted distally a little bit more. So make sure you define the cusp well.
Yep.
Come down this way, end of the burr out the groove. Come down this way to the marginal ridge, and then use the bite registration material to check the clearance there.
Got it.
And then you make this cusp reduce to match the distal lingual. Okay, so we're, the good news is you didn't reduce too much before I got here. A lot of times people get way over reduced.
Yeah.
So now check your clearances and see what you think.
Got it.
All right? Okay, so looking up this way, not enough clearance right here. I want to see the grooves a little more defined. So really make a nice well-defined groove here. And a nice well-defined groove over here. And round it in between. Round it in between. We don't want sharp cusps between the grooves. And you see this would have been a reasonable angle, but you went steeper here. So try to keep the vertical angle matching the opposing tooth as much as you can. Don't make it this steep. The good news is when you do the facial reduction, that steep area is going to disappear anyway. Okay, got a little more clearance than you needed on this ridge. And you're probably okay on the distal side. But again, we're going to try to define the ridges better. So come down this way. Just a nice flat plane right to the adjacent tooth, and then come down this way. Flat plane. Don't forget to bring the end of the burr out the facial groove. Down here to the marginal ridge, down here out the groove, then point the burr this direction. Not this direction, but this direction, tangent to the adjacent tooth toward the center. Come out the facial groove here, come down to the distal facial groove here, then down the distal cusp.
Oh,
Nope. I need to clean the burr.
Oh, sorry.
There it is, hiding behind there. Okay. Now when you do the distal lingual, make a definite ridge, and the bite registration material will show you where that ridge is compared to the opposing groove. Put a flat plane here, right down to the marginal ridge, flat plane here, right down and out the lingual groove. then this ridge and this ridge are going to come together in a V shape. So let's reduce more down this side. So down here to the marginal ridge, down here, out the groove. So now we have a V shape between these two ridges. This one comes to the center, this one comes down here. So now check your clearances in any way that you can, and then you can start the axe reduction whenever you want. Okay? Cool.
For my incisor.
Yeah, I'll take a quick look at that. I'll look more later. Well, okay. The central incisor there, I want you to look at it first. I want you to tell me what's wrong. So the evaluation that you did of that tooth, you should be able to show me that evaluation. Okay. You're sitting a little higher than I am. So let's go ahead here. I'm going to tighten your head on the mannequin rod. Okay, so on your A-plane, you're not making a very well-defined groove here or here. If I look up this way, well, you have very little clearance, don't you? You mark the cusp, which is a good idea. So now put grooves exactly where those triangular ridges are. See that?
Yeah.
So I haven't reduced quite enough yet, but the location is exactly where we want it. Your vertical angle is pretty good. So once you find the grooves, go back and forth between the grooves and get a nice rounded surface between the grooves, and keep working on it until the burr goes through here.
Okay.
So you don't have enough clearance quite yet. Almost over here. Almost over here, not quite enough there, and of course I didn't do any more in that area. But that's how we proceed. You can get it done quite quickly. So control the vertical angle. Your angle is pretty good, but make those grooves in exactly the right place.
Okay.
And then just go back and forth and shape it until you get a nice uniform clearance. So keep working like that. Okay, when you do the B plane, you're going to point the burr like this direction over here and this direction over here, and make nice flat planes. So for example, on the mesial side, you'll make a flat plane down here very close to the adjacent tooth, and another flat plane here, and bring the end of the burr out the face of the groove. That's all it takes. And then check your clearance, then you can move on and do the distal side of the B plane. But make sure you're really happy with the A plane first. Okay? All right. Okay, so you're making ridges on the A plane. There are no ridges there. It's nice and rounded. Make really well-defined grooves and a nice rounded surface. So you see on my drawing over there, see how rounded it is? You're making like ridges. And you're too horizontal. So you're not matching your vertical angle to the opposing tooth. So the opposing tooth is like this, but your A plane is like this. See that? Totally different. So normally what we would do is, make a groove maybe here, maybe over here, but check the location, make sure we're happy with where those grooves are. Then we cut at a more vertical angle from one groove to the other, and then from this groove to the embrasure, from this groove all the way over here to this embrasure. But see, it's nice and rounded between those grooves. Well-defined grooves, rounded cusps in between. Then we keep checking to see if we have the clearance. We're okay here, need a little bit more here, a little bit more here. We're okay over here. Okay, that's all it takes. But that's how easy it is when you start by putting the grooves in the right place, and you're careful about the vertical angulation. So here's the vertical angulation we should have matching the opposing tooth, and now it's much closer to what we should have. Okay? That's why we're now getting a really nice looking clearance, and it's very uniform from mesial to distal. That's what we're looking for. Okay. Now, so you already reduced the B plane a bit because you had the A plane too horizontal, so that cut away a lot of the B plane. But we're going to go back now and make the B plane at the vertical angle that we would normally do. Come down to the marginal ridge, and then come down here and bring the end of the burr out the facial groove. But keep the vertical angle matching the adjacent teeth like this. Keep the direction that you want. And then keep the end of the burr in the central groove, come down to the marginal ridge, come down here and out the facial groove. And that gives us the clearance that we need on the mesial buccal cusp. When you do the distal buccal, point the burr this direction. Pass tangent to the corner of the adjacent tooth, and then 1, 2, 3. Again, look at my diagram on the board. Take my type notes, look at the examples, and you can see exactly what's going on. Okay?
So, so when I am reducing lingually and giving chamfer, I always have a trouble having that starting point. So I start giving chamfer from the middle, from this area, and then try to go.
But if you look over there, I mean, you're touching the cingulum, you're not touching the chamfer at all.
I went up.
Okay? You were touching up here. Okay, so again, when you're doing axe reduction, just keep the end of the burr at the margin right here. Okay, and don't lean the burr away from the axis, lean it toward the axis, but always have the end of the burr at the margin. Now if you want a heavier chamfer, then make a 0.5 millimeter chamfer, then raise the burr and move the whole in, but keep the right taper. Okay, so is this the full ceramic that you did?
Both actually.
Okay, well, pick one and use your evaluation sheet and evaluate it. And I want to see what you see in terms of the evaluation. Okay?
Sorry, I have one more question.
Oh, okay.
And another difficulty that I'm having is like breaking the contact. So like when I'm coming from here.
You're having trouble going through the proximal contact without hitting the adjacent tooth? Okay, well, how do we do that? How do we go through the proximal contact without hitting the adjacent tooth?
So I try to...
No, but how do we go through the proximal contact without hitting the adjacent tooth?
Using the chamfer burr and then...
But what do we do with it? How do we go through the contact without hitting the adjacent tooth?
By leaning it towards the tooth structure.
Well, of course, we always lean it axially, but how do we avoid hitting the adjacent tooth? What's the secret? What's the big thing?
Looking along that.
Not... Well, yeah, looking horizontally on the wall, that's necessary. Yeah. But when we're doing it, what do we do that guarantees that we have a chance to avoid hitting the adjacent tooth? Go farther gingivally.
Yeah.
That's the key. Keep the end of the burr at the margin, lean the burr toward the axis, but put the margin really close to the gingiva if you need to, as close as you need to, so that you have the room. That's how we do the proximal reduction every time. Okay? All right.
I messed up here.
You messed up?
Yeah,
oh, dear.
Over fevered, I feel like, and I couldn't find, I realized at the beginning that I didn't find the distal reach.
Well, you didn't find the grooves.
Yeah.
There should be a groove right here, shouldn't there? So look on the monitor. You might want to turn the monitor so you can see it. So, you know, the opposing cusp is telling you where to put the groove, but you put it over there instead.
So it should go vertically from the cusp, or it should go towards the tooth is going, you know, like the axis of the tooth.
Well, you see my diagram over there in the middle? The grooves are exactly where the opposing cusps are. Exactly.
So vertically? Okay.
So you got it shifted about 1.5 millimeters mesially. Over here, you don't have a very well-defined groove. It should have been right there. So you're...
Yeah, because I didn't know where to put. Can you show me this distal? I understand the...
Well, okay, now here's the buccal groove. So we'll try to put it about right there. And the distal groove, let's try here and see how that works out. So make a couple of little grooves. Now we're going to see if we put them in the right place. Okay, to see if we put them in the right place, we're going to look in the mirror. So now the groove that I just made right here is fitting where the opposing cusp ridge or triangular ridge is. Obviously, it's different from this. Over here, it's close. I'd probably go a little bit farther mesially. Now you're already over-reduced here. So, but the key, the very first thing you do is make those grooves, and you keep them very well defined. And then from this groove to this groove, make it nice and rounded and convex. From this groove to this embrasure, keep it nice and rounded and smooth and convex. But make very well defined grooves and nicely rounded cusps in between, and it's going to fit the opposing tooth way better. Okay? So I could even up the clearance a little bit more. You're a little bit over-reduced, but I could even it up a little bit more. But again, if the grooves aren't in the right place, you're doomed. It's just never going to work.
Yeah. because I couldn't find it.
Okay.
I mean, I didn't understand how to.
Yeah, but you see, here's the opposing triangular ridge, and now we have a groove exactly opposite it.
And then when you do the grooves, then the facial buccal, which one is that? Buccal distal, right? Facial distal groove. I saw that you were putting the burr like it was maybe like that.
So this groove right here?
Yeah. When we were doing when you were doing.
Oh, that's the B plane. We're
Yeah.
still on the A plane.
Yeah. So.
Okay, we'll get to the B plane in a minute.
Okay.
So, any question? Is it clear what we should have done on the A plane?
Yeah.
Okay, now when you're doing the B plane, again, don't forget to take the vertical angle from the adjacent teeth. Don't make it too horizontal. Get the vertical angle from the adjacent tooth. Get the direction of the ridge, and then point about this direction, and then keep the end of the burr in the central groove, and reduce much closer to the adjacent tooth so you get a longer plane, and then make a plane over on the other side, and bring the end of the burr out the facial groove when you bring the plane down the other side. 2 flat planes with the ridge going in the right direction and the vertical angle right, and then it's pretty easy to get the clearance there. Now when you do the distal buccal, point the burr this way, tangent to the corner of the adjacent tooth toward the center, and keep it pointing that way for planes 1, 2, and 3. Okay? Give that a try. This is your full ceramic? Okay, so yeah, again, I want you to evaluate it yourself on the evaluation form first.
I did, actually.
Good, okay. And you had a PFM there to start with, so probably you had the tapers and everything figured out.
Yeah, you told me that I over tapered, so I tried to make it more.
Okay.
So what I put here, that the axial reduction at the shoulder is fine, but on the mesial buccal I did too little. It was like 0.7. I tried to make it more today.
Well, just take, you got the ball burnisher, let's just measure it, see how it is.
This one.
Okay, so take the 1 millimeter end, and we look down here, so you got about 0.9 there, about 0.8 over here, about 0.9 here, about 0.8 here. Probably about 1.1 over here. In this area, about 0.9. So, you're around 1 millimeter everywhere. And of course, we want an exact 1 millimeter everywhere. But you're still okay. Not a big problem.
And then facial chamfer angle, I think I did over-tape it, no?
Well, let's check all the chamfers, make sure there's no ski jumps anywhere. So everything is sliding off, so that's good. You got more in size reduction than you needed. Just, 2.5 millimeters would be fine. But, the taper and everything else we talked about when you did the PFM. So, but in any event, keep the chamfers a little more uniform. But, it's pretty good. We're going to check jaw. You've got most of the edges rounded over. You might be a little bit under-reduced on the cingulum because that wall is pretty tall, so I'd probably reduce the cingulum more and then round over everything else.
So,
but this would work.
This is too tall, the cingulum, or I over-reduced the cingulum, so...
Yeah, you under-reduced the cingulum here, so that wall in the lingual is pretty tall. Normally it's going to be about 1.5 millimeters or so, so I'll reduce the cingulum a little bit more.
Okay, so I can reduce it more.
Yeah. But again, this prep will work. So that's good.
Okay.
All right.
So I tried using the impression and then...
Oh, that's interesting. You're doing it with the light on the phone. I haven't thought about that before.
So much light is coming out. It's bad.
Okay. I'll try it both ways, so we can look. If I can get this bulb twisted around the right way. Oops. So we're going to turn off, if you're wearing a headlight, turn off the headlight. Did you mark with a pencil? I think you did, didn't you? No?
Nope, I didn't.
Okay. To me, it looks like you've certainly got enough reduction, probably too much. But yeah, putting on here. This is actually good. It's actually better than the regular light.
Yeah, the other one was too bright.
Yeah, well, this is even brighter, but it's smaller, so it's more focused where we want it. So I suspect your clearances are probably pretty good, but take the typonant out of the mannequin and check from the throat, see if the distal lingual cusp actually does have clearance.
Got it. Thank you.
Okay, cool. A new idea. Okay, so let's see, I want really nice grooves on the A plane. So let's see, your grooves are fairly vague. Your vertical angles aren't too bad, but I don't see really clear grooves. And why didn't you stop? So your clearance over here is a lot, right? You have way more than 1.3 or 1.5.
Really, I was thinking it's enough by just.
Well, again, if we take the burr should just fit through there. There's a lot of extra room there. You could take the ball burnisher and measure the clearance too, and it's probably way more than 1.5. I would have made a groove about right here and a groove about right here. Let's see if those grooves fit the opposing tooth better. Well, maybe not quite that far distally. Maybe about right there. So we're going to really concentrate on getting really well-defined grooves in exactly the right location. And then between the grooves, just make it nice and rounded. Smooth, curved, rounded. Your vertical angle is pretty good. Don't forget to come from the embrasure into this groove, from this groove around into this groove, and from this groove all the way around here into this embrasure. So rounded surfaces from embrasure to groove, groove to groove, groove to embrasure. So you got too much clearance, but now it's getting a little more uniform. Again, put the groove exactly where the opposing cusps are. Okay, now the B plane I can tell is too horizontal here. So see how horizontal you are there? It should have been more vertical. Then you get more clearance toward the central groove. You don't have very much clearance at the central groove. At the central groove here, you have very little clearance because your B plane was too horizontal. So point the burr this way. Make the burr more vertical. Match the vertical angle to the adjacent tooth. Reduce the central groove more. Come closer to the adjacent tooth. Then come down this way. And don't forget to bring the end of the burr out the facial groove. So now we're getting a flat plane here and a flat plane here and out the groove.
Occlusally, yeah, it looks like non-occlusion.
And now we're getting the clearance that we need. On the distal buccal, you don't have enough clearance. Point the burr this direction. But, you know, when you're doing this, make sure you do it until you get the clearance that you want. And then go on to the C plane. Don't stop the plane before you have enough clearance. And then move on to the next plane. Okay, so you can check the clearance on this ridge, but at least the ridge is going in the right direction now. And then over here, we want to make a definite lingual groove. So come down this way and bring the end of the burr out the lingual groove. So come down, point the burr in the right direction, put the ridge in the right position, come down this way, bring the end of the burr out the lingual groove, come down this way.
So I undercut it, right? You know, it was my cutting was not sufficient, like on plane C.
Well, we don't know. I don't know how much clearance you had, but I wanted to define the ridge a little better. When you define the ridge better, when you use the bite registration material, it's easier to see what you're doing. And then again, don't be so horizontal. You're getting very horizontal here. Keep the burr more vertical. You can take the angle from the adjacent teeth.
Yeah, it helps. Yeah.
Yeah, and then keep the end of the burr in the central groove and actually make a central groove here.
So our occlusal anatomy should look like just like the adjacent tooth, right?
The vertical angle, yeah, take it from the adjacent teeth. That'll be fine.
Yeah, not the angle, but also the anatomy, like, you know, the anatomy.
The direction of the ridge?
Yeah, and everything, like, you know.
Yeah, you have two ridges here. They're going to come together just like I drew on the board. Two ridges here, they come together in a V shape. That usually works out just fine.
Just like, you know, this.
And this is totally different over here. 3 planes there, and then the 2 planes over here. So now we've defined the anatomy a little bit better. Now you need to check, make sure you have the clearances correct in each area. Particularly right in here. Use your ball burnisher to see if you have enough clearance here, just the way I did.
So for the ball burnisher, how can I see the...
Well, we're going to try to see if the ball burnisher will cross over this ridge, right? But obviously, when the typodon is closed. So close it and see if the ball burnisher goes over the ridge.
It
It is.
No, it's not. But you do it, and then you can see. If it doesn't cross the ridge, then you do some more reduction.
It should cross the ridge, right?
Yeah, cross the ridge and have a little extra room.
Oh,
Okay,
Could you-
when it's closed.
okay.
Okay,
From this side, like from this way, like this, right?
you can't do that. When it's closed, you can't do that. So let me show you.
Yeah, I know that. That's why I'm saying. Like,
Okay, I'll show you again. So this is the direction that the ball burnisher is going to go here. You're going to see if it goes over that ridge, down here or up here. So close it down, and then see if you can get the ball burnisher going that direction. So you see what I'm seeing now, and the ball burnisher is not crossing that ridge.
I should cross that ridge.
So now we've got under reduce that area. So you've got the anatomy I gave you. You got the vertical angle, you got the direction. Now reduce until the ball burnisher fits over easily. Okay? All right. A loose head and a loose typing on it. There we go. Okay, so again, your A-plane's really vertical, isn't it? So the angulation that matches the opposing tooth would be about like this. So this is the angle of the opposing ridge right there. But you see, you're much steeper than that. You're way down here. So this would have been the angle that you wanted. See how much more vertical you are there? That's why your facial margin got really close to the gingiva. Okay, so then we need to make sure you find those two grooves. See, one of the grooves should have been exactly here. Use the mirror so you can see what you're doing. That's where the groove should have been there, and this is where the groove should have been here. So let's make the grooves again. So it's like I'm starting over again with your A-plane. Make a groove where you think the opposing ridge is. Make a groove over here. And then see if you got the grooves in the right place. There we go. Okay. Now, again, without being so vertical, just make a nice smooth connection between the grooves. Groove to groove here, and groove to embrasure here, and then groove to embrasure over here. Bring the plane nice and rounded all the way around into the embrasure. Again, nice rounded planes. Okay. But the vertical angle is critical. So now your clearances are a little much, but they're more uniform. And again, you got grooves that match the opposing tooth. That's what we want to see. Okay, now the B plane. So over here, you're definitely over-reduced. So you're too vertical here. So a little less vertical. You can take your vertical angle from the adjacent teeth. Okay, so look at the monitor so you can see I'm taking the vertical angle from here or here or here. But don't make it too vertical. And then keep the central groove more in the middle. If you're too vertical, then usually the central groove gets shifted out, in this case, buccally. So I'm redefining the central groove a little more toward the middle of the tooth. And then when you do the distal buccal, look at the drawing I did. Point the burr this direction, tangent to the corner of the adjacent tooth, just like I drew on the board. Point it that way when you're doing these three planes. Plane 1 coming out the facial groove, plane 2 coming down to the distal facial groove, plane 3 down the distal tusk. 1, 2, 3. With the burr pointing in the right direction. Then check your clearance there. And you've got plenty of clearance there right now. Okay, but we're just basically trying to get the anatomy. Now over here, you have no ridge. How are you going to fit the ridge to the opposing groove if there is no ridge, right? So let's make sure we make a flat plane down here. And then bring the end of the burr gently out the lingual groove. And then make a flat plane down here. Once we get two flat planes, we've got a ridge. And then you'll use your bite registration material to see if you have enough clearance there. It looks like you probably do. And again over here, also two planes. This plane down to the marginal ridge right next to the adjacent tooth. And this plane down here and bring the end of the burr out the lingual groove. So that's how you define each of these planes. Make sure you get the burr pointing in the right direction. Make sure you get the right vertical angle. And cut nice long planes the way I'm describing how to do it. Okay, so your axial reduction now is over-reduced, but the anatomy is looking pretty reasonable. So now why don't you do some axial reduction? See if you can do facial lingual axial reduction and so forth. The PFM, the full ceramic, I'll look at a little bit later. Is this a full ceramic? Or is this? I guess this is, obviously. Oh, the good news is it's obvious which is the full ceramic. That's cool. Okay. Now, so your axial reduction at the shoulder is fairly uniform, a little less over here, a little more over here. But did you check to make sure that you didn't have any ski jumps? Because a full ceramic hates ski jumps even more than everybody else does. Big ski jump there. Big ski jump over here. Again, slide the ball burnisher down. If it doesn't slide off, either you have a shoulder that's not angled or you have a ski jump. So again, when you make a heavier chamfer, make a nice chamfer here, and then raise the burr and move the wall in, and you can't get a ski jump. If you don't raise the burr, you get a ski jump. Okay? So a little more care on that, but I'll be interested to see what you said in your workbook about that. Okay? Okay.
This monitor is not working this morning. I don't know.
That should do it, but maybe the cord got unplugged in the back, so I'll double check that. In the meanwhile, you have to watch the other ones. Okay, so you don't have an A-plane. So when we do the occlusal reduction, so you started the axial reduction already. Okay, you're moving along pretty fast. Okay, good. Okay, so the A-plane is made with the burr about this angle here, but you have no A-plane. Your B-plane got too horizontal, maybe that eliminated your A-plane, so the vertical angles are hugely important. You've got grooves. That facial groove is shifted a little bit mesially. You don't really have much of a groove on the distal side. So you'd expect to have a groove here, and this groove about right here, and then nice rounded surfaces in between. That's how we do the A-plane, right? And then compare it to the opposing tooth. You got too much clearance, but now the anatomy fits better. So the point is to get the anatomy fitting well before you have too much clearance. Then it looks really, really good. Okay? So vertical angulation, making nice grooves. Now over here, see this ridge should be pointing this way. So you're 45 degrees off on the direction of that ridge. So look at the diagrams, look at my examples, you can see the angles. Flat plane here, make flat planes and well-defined ridges and well-defined grooves. Down here, out the groove. The center groove would have been about right here, not way over here. Okay? When you're doing the distal lingual, come down this way, then come down this way, and bring the end of the burr out the lingual groove. So I'm making flat planes wherever we are. Point the burr in the right direction, bring the end of the burr out the facial groove, then come down here to the distal facial groove, and then down the distal cusp. Planes 1, 2, and 3. 1, 2, 3. And then the distal lingual, you need a ridge here. So I come down this way, out the lingual groove, and then come down this way. Make a flat plane here and a flat plane here. Then we get a ridge. And then you can check to see if the ridge is in the right direction, you're getting the right clearance, and so forth. I would have shifted that ridge more to the distal if we'd seen it earlier. So your anatomy now is basically pretty close, except for you're way over reduced. Okay? So you could have done the same anatomy, but just not reduced as much, and you would have been much better off. Okay, so your chamfers are all pretty weak, so whatever burr you're using for the chamfers, make sure you reduce until the end of the burr gets to the margin. Okay, so try to make nice uniform chamfers. The convergence facial lingually looks pretty good. Mesial distally, it's close. It may be a little tight. Mesial distally. So a little more taper probably on the mesial side. Chamfer is a little bit heavy over here, right? So check it for a ski jump. If the end of the burr is not at the margin, you're probably getting a ski jump. And check draw between the corners as well. So a little issue with respect to the taper in this corner. Make sure you see the distal buccal and the mesiolingual well at the same time. So a lot of times people get draw facialingually and mesiodistally, but in the corners they get undercuts. That's really common to see. So that's why we check all 8 walls, all 4 different pairs of walls. So is this your full ceramic? Mm-hmm. Okay, it should draw better than that. It's got to get plenty of taper, plenty of conversions. Okay, if it's even close to parallel, the ceramic's going to break. Okay, so get plenty of taper, at least 12 degrees or so. Don't make it so there's any doubt. See what you're doing here. You're leaning the burr the wrong direction over here. See on the monitor? You're leaning the burr outward instead of toward the axis. So that's what gives you undercuts. Okay, and those are devastating, especially on an all ceramic. And see the margin right there?
Mm-hmm.
It's really easy to see that undercut, or the ski jump, isn't it?
Yes.
Look how easy it is to see that. So come back around, get rid of the ski jump, make a nice chamfer, raise the burr, move the wall in until you get 1 millimeter oxy reduction. But make sure you're always looking along the wall so you see the taper that you're using.
And anything little taper?
Well, you have an undercut, so obviously, yeah, you need to get some taper. But make sure you're looking along the wall so you can see the taper that you're doing while you're doing it, okay? So we look along the wall this way, so you know you're not leaning the burr toward the adjacent tooth. Lean it toward the axis. And by the way, you should never have an adjacent prep.
Yes.
Right? Why would you do that? Maybe it made it harder because when you have an adjacent prep, you don't have to worry about hitting the adjacent tooth, so you start leaning toward the adjacent tooth, and then you get an undercut.
I did this one later on.
Oh, okay. All right. But never do 2 preps next to each other.
Practicing.
Yeah. Well, practice on a tooth that has intact adjacent teeth. That's a much better way to do it. Okay, so again, make sure you're always looking along the wall so you know the taper, you know the chamfer, you know where the end of the burr is. You can see, so now I'm getting rid of your ski jump. So I'm dropping it gingerly to get rid of the ski jump. Then I'm going to raise the burr and move the whole wall in. So I can move the wall inward as long as I lift the burr up incisally, and then I don't get a ski jump, and I can make the chamfer as heavy as I want. Okay? So look along the wall so you see exactly where you are occlusally, you see exactly where you are axially, and keep doing it and adjusting it until you see a nice uniform 1 millimeter all the way around. Okay? Mm-hmm. Alrighty. So, yeah, we're going to be try to make the chamfers here more uniform. That is, make sure that you always see the end of the burr at the margin. So 877, 878, K014, either one. Look along each of those walls and make sure you don't stop reducing axia until you see the end of the burr at the margin. Then you have a perfect 0.5 millimeter chamfer everywhere.
Yeah, I think I'm lifting again. I should do in one stroke.
Well, you're just not going far enough inward, so make sure you're looking along the wall so you can see that you're going axially enough. And when you see the end of the burr at the margin, then move to the next place. Don't just sort of rub it on gently because your chamfers are like just a couple tenths. No, okay. Okay, so you've sort of got grooves. You've got a little bit of a groove here and a little bit of a groove over here, but in between you're making a cusp. You're trying to make it too sharp in between the grooves. So if you want a groove here and another groove over here, in between make it rounded. It's going to fit the opposing tooth better if you make a rounded cusp between well-defined grooves. Same thing here, put a groove here, come into the embrasure, make it rounded in between. You know, don't cut upwards this way and make a cusp. It's not sharp there. So you're still a little bit too sharp making a cusp bridge. would have been nice if it would come up like this, and then come rounded right down in there. Okay, so your B clearance looks like it's probably okay, but you didn't have to reduce as much as that on the distal buccal side because you have the ridge going totally in the wrong direction, and this ridge is in the wrong position. This ridge should have been closer to the marginal ridge. Down to the marginal ridge, down here, out the facial groove, and then point the burr this way, come out the facial groove, come down to the distal facial groove, then down the distal cusp. So plane 1, 2, and 3, all with the burr pointing in this direction. Now if you're not sitting in the same position I am and looking down the axis as much as you can, then you have no idea what direction you're pointing that burr. You got to see the direction you're pointing the burr when you're doing it, and then it works out much better. Okay, but you had plenty of clearance there, way over-reduced on the mesial side. Now your clearance on the distal side looks pretty reasonable. And then we want a ridge here that a lot of times you're going to be shifting it pretty far distally, but the bite registration material will show you where to put it. But a long plane down here and out the groove, and then a short plane over here, flat plane here to the marginal ridge, flat plane down here and out the lingual groove. That's how to get nice flat planes and a well-defined surfaces and well-defined ridges. Okay, so we're a little bit over-reduced, but at least now we've got the anatomy straightened out a little bit. You weren't too far off on your A plane. Now go ahead and use the chamfer burr and make a chamfer as much as you can all the way around. I'll be starting to talk about the upper molars in just a few minutes. Okay. All right, I'm going to talk about the maxillary molars in a few minutes. Most of you should be working on or finishing your axial reduction, so your chamfers and your tapers and so forth. But in a few minutes, I'll talk about the upper molar, and then we can start on that one.
I just want to ask you something.
Mm-hmm.
So I took the bite dentistry,
Mm-hmm.
and then it shows I have some. I need some. Okay. Yeah. So I need some mesial, lingual, and distal lingual. The most on distal lingual. So I cut some.
Well, let's take a look.
Yeah.
Okay. So first of all, this is the opposing tooth. Here's your prep.
Yeah.
So you have to figure out what plane is what. So I think there's the A plane. So yeah, the distal lingual. Yeah, I see where the distal lingual area is. The most white area is where the distal cusp is. That's where we haven't really reduced it yet.
Yeah. So I did that. I just reduced a little bit. So see if it,
Okay.
like If,
So, but on both sides of the lingual groove and the ridge on the distal buccal part of the B plane seem to be pretty much under-reduced.
Come again.
I'll show you. So there's 3 areas that are under-reduced, it seems.
So yeah, I just reduced.
Before we get confused. So 3 areas that are under-reduced.
Okay. So I just reduced.
And 3 areas that are under-reduced. Okay. I have to look at it again. I forgot. Okay. So here's the A plane. Okay. So I have my own light on right now, but
I can switch off my cell phone light. Yeah.
no, I was using it. So right here it's under-reduced, and then right here and right here it's a little bit under-reduced. That's what it looks like from the light. So that this mesial lingual cusp over here is coming down too far right here. So reduce the ridge more down here, especially at the central groove. Reduce this plane down here. Reduce this plane down here, and then check it again. Okay?
Oh,
that'll be cool. And then you can start your axial reduction anytime. All right. Okay, so let's take a look here. So your A plane's not too bad. We could probably have made it a little bit more defined in this area, but you're pretty good. And when you do the B plane, you want to have the ridges not going facial lingually. You want to have this ridge pointing a little bit of a diagonal direction, and then point very much diagonally here. past the adjacent tooth, tangent to the corner of the adjacent tooth toward the center.